This video shows our systematic approach to diagnose arthroscopically a posterior root avulsion tear in the lateral meniscus after identifying a radial body tear in that same meniscus in an ACL deficient patient. We present the case of a 24-year-old patient who sustained an injury of the left knee in soccer practice. The MRI showed that beside his ACL rupture, he also had a radial tear of the body of the lateral meniscus, which was identified on this axial cut with the blue arrow pointing towards it, as well as an oblique tear in the posterior root of the same meniscus, which was identified on the sagittal cut with the blue arrow pointing towards it. Since we know that MRI only has a 69% sensitivity and 88% specificity of diagnosing an arthroscopically confirmed posterior lateral meniscal root tear, it is important to have a thorough systematic arthroscopic evaluation of the posterior root of the lateral meniscus during an ACL reconstruction. With the knee in a figure of 4 position and the arthroscope placed via an anterolateral portal, we identify the radial tear in the body of the lateral meniscus. The insertion of the probe showcases such a lesion. This should be an alerting sign to go probe the posterior root of the lateral meniscus so as not to miss a lesion of the meniscotibial attachment. In this case, we had a concomitant oblique tear in the posterior root of the lateral meniscus. To encompass the whole meniscus in a single visualization through the arthroscope, we recommend switching portals to better visualize the posterior lateral meniscal root from the anteromedial portal. This can be done while variating knee flexion to better optimize visibility. Once the posterior root is clearly visualized, one should assess for a lift-off sign to eliminate a complete root avulsion of the posterior root, which isn't present in this case. In this case of oblique lesion, we opted for a repair with suture anchors and a regularization of the radial body tear, which isn't shown in this video.